Cataract is a disorder in which the natural lens of your eyes becomes cloudy, and as a result, leads to blurred vision. It means your eyesight becomes faint, but you did not lose your vision. Cataracts in the eye are not harmful, but if not treated on time, they could lead to blindness. The main cause of cataracts is genetics, so this disorder can transfer from parents to infant. Any eye injury or infection can also lead to cataracts. A cataract patient may experience blurred vision and dual image formation at the retina. Various strategies or tests, such as a slit lamp examination, are commonly used to diagnose this condition. Multiple treatments are available, however. Surgery is the leading, simple, and easy option to get rid of cataracts. Let's explore different types, symptoms, treatments, and preventive measures of this disorder. What are cataracts? Cataracts refer to clouding in the lens of the eye. In normal conditions, just beyond the pupil, a clear structure focuses the light on the retina. However, in people with cataracts, the light cannot pass through the lens due to lens clouding. Hence, cataracts change the vision into blurry, hazy, and milky. Cataract eye does not perform the function properly and may cause trouble in reading and during other activities. Cataracts progress unevenly. In some people, they develop slowly, while in others, as age passes, they become more common and worse. That's why cataracts can also lead to loss of vision over time if left untreated. How are cataracts formed? As mentioned earlier, cataract is a disorder in which the eye lens becomes cloudy. The lens is positioned just beyond the colored part of the eye, iris, and focuses the light that passes through the eyes, which ultimately produces a sharp image on the retina. With aging, the flexibility of the lens is reduced and becomes unclear. Some medical conditions also lead to the breakdown of some fibers and proteins within the lens and clump there, which causes the lens to cloud. The cataract grows, and this clouding of the lens becomes severe and blocks the light when it passes through the lens. As a result, a sharp, well-defined image cannot reach the retina, which leads to blurred vision. Cataracts can be generated in both eyes, but sometimes they develop in one eye, which is also worse as it causes a difference in the vision of two eyes of the same person. Types of cataracts. Nuclear cataract, a type of cataract in which the center of the lens is affected by a cataract. It causes the blueness of the object, which is far away, but the closer object seems clear. This type of cataract does not affect the reading capability, but the lens becomes more yellowish with time, thereby worsening the condition. As a result, a person cannot differentiate colors. Cortical cataract, when a cataract affects the edges of the lens. This disorder is known as cortical cataract. In this condition, a white wedge-shaped spot is formed at the edge of the lens. This streak reaches the center of the lens as the cataract grows. Congenital cataracts. Some people may develop cataracts by birth, indicating that cataracts may also pass from parents to children. These cataracts are called congenital cataracts and may be due to an infection in the womb. Rubella infection, also called German measles, and galactosemia, which is a rare genetic disorder associated with the body's inability to metabolize galactose due to deficiency of galactose metabolizing enzyme. If this condition is not treated timely, it may cause accumulation of galactose in the body, leading to damage to the eye lens. Causes of cataracts. Cataracts usually develop when any injury changes the tissues of the lens. It could develop with aging and mostly occur over age 65. The protein and fibers of the lens start to break down, which leads to blurred vision. Some other reasons that increase the risk factor of cataracts include having parent or siblings with cataracts disorder, a person who already has diabetes, having eye surgery or any eye injury, or a person taking regular medications such as corticosteroids, which cause early formation of cataracts. A person experiencing sun rays, especially ultraviolet rays, without any protection, such as sunglasses, has a greater chance of developing cataracts. Cataracts symptoms. In mild conditions, cataracts usually do not show any symptoms. However, as the condition progresses, it may lead to a change of vision. Some common symptoms include cloudy or blurry vision, colors looking faded, night blindness, the highlights and sunlight looking too bright, and sometimes things appear double in cataract eyes, especially when cataracts are bigger in size. How to diagnose cataracts? Various tests are performed to diagnose cataracts. An ophthalmologist may take the ophthalmic examination of the patient, in which he examines the patient's visual acuity. He may take a slit lamp examination of the patient, in which the front structure of the eye is checked. Some other examination tests involve contrast sensitivity tests, potential visual tests, and specular microscopic of the cornea. Treatments for cataracts. If you want to get rid of cataracts, it's only possible by surgery. Surgery is a very simple procedure that takes just 15 minutes. Some home treatments are also possible by using brighter light at home, wearing anti-glare sunglasses, and using magnifying lenses while reading. Use new eyeglasses or contact lenses to see better with cataracts. The treatment option is your own choice. Talk about it with your doctor. While treating your cataract with surgery, kindly ask your doctor to give you an idea about the benefits and risks of cataract surgery. Removal of cataracts involves several methods. The most common method involves the phacoemulsification technique. In this technique, the cloudy part of the lens is broken down by using an ultrasound probe, in which a tiny incision removes that piece. A soft plastic intraocular lens is inserted carefully. If cataracts are not treated, they can enter into someone's daily life and could lead to blindness. This disorder does not recover by itself, hence surgical treatment is commonly used with about 90% effectiveness. How could cataracts be prevented? There are no studies that tell the prevention or slow growth of cataracts, but some strategies could be helpful, which include regular eye exams to detect any issue in the eye at its early stage. If you have a habit of smoking, quit it. If you are experiencing any medical issues like diabetes, then follow medical treatment to avoid the risk factor of cataracts. Focus on a healthy diet, which includes fruits and vegetables. Balance your nutrients and vitamins. Reduce the usage of alcohol. Use sunglasses while exposed to sunlight to avoid ultraviolet beta rays. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.